I'm with Dr. Grant Mullen, and he has written a classic, Emotionally Free, a prescription for healing body, soul, and spirit. This book puts it all together in a way I haven't seen in a long time. The nearest thing to this was Paul Little's book 50 years ago, Nervous Christians.
Yeah, Paul Little I was a great fan of him.
Well, and I've looked for something like this book because there's many Christians that just kind of waver. And then there are Christians that are depressed. Now, we've got this catastrophic number of depressed people. Tell us about depression. How do we get rid of it?
Well, depression is now like a modern epidemic. The World Health Organization says by the year 2020, it will be second only to heart disease as a cause of disability in the workplace. But depression affects, or the mood disorders, depression, anxiety, and mood swings affect 10 to 15% of the population at any given time. But that also means 10 to 15% of every congregation has a mood disorder, and 80% are undiagnosed and untreated. That's what concerns me. That's why I wrote the book. That's why I do seminars, is to help people diagnose themselves, identify themselves, because the walking wounded crowd is their relationships, their whole life is suffering because they're untreated, undiagnosed.
You also know that some Christians, that they really get hung up when they get on an antidepressant, and they think that what's going on with me. Where do you bring the area of deliverance or simply addressing depression?
Well, there are of course 3 parts to humans, and there's 3 parts to our emotional recovery. So if you have a chemical imbalance mood disorder, the treatment for that is medical and divine healing. And then Satan loves to take advantage of any weakness we have, and so mental health problems are a weakness that he wants to take advantage of. So if you're already feeling depressed, he'll want to give you more things to be depressed about, to magnify your problem. And of course, we all have emotional baggage, and emotional baggage expands when you're depressed because everything is overwhelming. But my concern is that so many Christians refuse treatment for their depression because they feel it's just a spiritual issue or just an emotional issue or just a faith issue, and so they refuse to take the medical treatment part, and so they suffer unnecessarily.
Okay, what is the medical treatment part?
Well, we know that mood disorders are a biochemical abnormality. So it's like having diabetes or thyroid problem. It's just that your neurotransmitter levels, the serotonin levels in your brain, are low. So if your insulin level is low, we give people insulin. If your serotonin level is low, we give people antidepressants, which restore the serotonin and restore thought control. The #1 symptom of a mood disorder is, I can't shut my mind off. So if you're depressed, you spiral down. If you're anxious, you worry. And if you're bipolar, you swing up and down. But you can't shut your mind off. The medicines just restore thought control. And once you have thought control restored, then you can use your spiritual authority to push out Satan. Then you can successfully move through counseling, getting rid of your emotional baggage, but you need thought control to start.
Is there hope to ever get off an antidepressant?
Well, it all depends how long you had depression before. So most of the people who came to my office, they were depressed for about 20 years. It usually starts around adolescence, and people don't seem to come for help till they're in their 40s. So it's like 20 years. So for people who have had it for long periods, they need to stay on their medicines or the problem will come back. So it's no different than I wear contact lenses, and I will forever, and if I take them off, I have a complete relapse, so I just keep them on.
And we're in an age of technology and research that benefits us. We shouldn't feel guilty about it, right?
No, treating a serotonin deficiency is no different than taking insulin or a thyroid pill. Like, it's just another medical problem. We have to stop over-spiritualizing it. This is just a medical problem, but it has spiritual symptoms, but to treat it medically and recover, don't put up with it.
Now, your book is really a classic, in my opinion, because it brings all of these key areas together. Tell our audience why they need to get your book regarding this issue of depression.
Well, because so many Christians are suffering unnecessarily. Remember, 80% are undiagnosed, untreated, and they assume it's a spiritual issue or weak faith or they haven't done enough devotions. And I'm just saying, if you go through the book, you can diagnose yourself, you can tell if it's physical, chemical, and then take the checklist there's a checklist they can do to compare themselves to, take that to their doctor and get treated. I mean, there should be no shame in treating a medical condition as a Christian.
We've been listening to Dr. Grant Mullen, and the book is Emotionally Free, a prescription for healing body, soul, and spirit. I can't think of anything more important for you to put in the hands of your wife or husband, your kids, particularly young people in the university, people that are really trying to score high in a competitive world. They need this book.